So I am now working in private practice. So after I graduated from my master's, I started here at a private clinic in Ottawa called the Ottawa Neurofeedback and Psychotherapy Center. So we have a couple locations in Ottawa, and I'm just working here full-time doing psychotherapy primarily, but we also do this really cool thing called neurofeedback. So it's basically like it's a type of biofeedback. So it's like brain-based training using like computer interfaces and kind of like advanced technology. And what we're doing is we're trying to kind of help people to train their brain waves, essentially using this really cool technology. So I'm working with a team of, I think, about 20 therapists, social workers, psychologists, and we treat a whole range of patients, or clients, I should say, from a whole range of different, with a whole range of different presenting problems. So all ages, we see people with, PTSD, ADHD, anxiety, depression, concussions, different learning disorders, a whole range. Like, it's very, very broad. So I'm really liking the variety of what I'm doing day to day now. It's been great. Yeah.
Cool. That's really interesting. So sort of a combination of psychotherapy as well as the kind of neurological components to it, sort of thing. So does everybody do both, or is it just some people that are doing the brainwave stuff? Or
that's a great question. So I do both, but therapists kind of, there's a lot of us that do both, but we have some clinicians who just do the therapy or the assessments, and then we have other people who just do the neurotherapy. So it's kind of nice that I had the opportunity to do kind of like a hybrid. So my days are very, they look very different, we do not just one type of neurofeedback either, we do several. So the length of the session and the types of clients and like it varies throughout the day. So it's like never a dull moment. Yeah.
Well, and I guess so you don't get to stay home then. Obviously you have to do this in an office somewhere, kind of thing. Or
yeah, so I'm at the clinic now. And yes, we do offer virtual sessions, over telehealth. So we do video or phone sessions at the client's request. We are encouraging most therapy clients to do it that way, but I also work with kids, so it's really tough sometimes to do video sessions with 6 and 7-year-olds. So it's often better to just have them come in and use PPE and wear a mask during session, and we have about 15 minutes between to clean. Right. So yeah, so it's still pretty safe, but we're definitely in clinic because it's really hard to do the neurofeedback.
Yeah, I was going to say that would be difficult. So now, is this your first real job after the master's in education, or have you done anything? I think I've lost track of when exactly you finished up and where you are right now.
Okay, so I graduated my undergrad from Carleton in 2018. So after that, that fall I started right into my master's. So at that time I was still working at Carleton. I worked in the Career Services Center. Right. And then after that, the following summer, after my first year of my master's, I still worked at Carleton, but I worked at the Academic Advising Center. So I did that for a summer as well before eventually starting my internship. And it just so happened that where I did my internship for my master's ended up being where I got employment after. So it really worked out for me that way. So yes, I've been here the whole time, just learning different things, different therapeutic approaches, getting different trainings. So it's constantly evolving, but yes, I'm in the same spot.
I come from a very, very artistic background. Both my parents are artists, art teachers. So that was kind of my primary focus. And what I originally wanted to do was go into arts management. So I was actually in University of Toronto before I switched to Carleton. And so I was taking a completely different program. It was business and fine arts, with the intention of becoming a museum curator. And I actually didn't like it at all, and realized that, yes, I like going and visiting museums and theater, but I didn't actually want to be involved in that world. I was actually fascinated by my roommate's intro psych textbook, and I was flipping through it, and I was just like, whoa, you're learning this is so cool. You're in this program, you're learning about babies and emotions and just the brain. And it blew me away. And so I didn't even have, it just seemed natural that was the program I was going to apply for. And I loved it ever since I stepped foot into the program. So no regrets. For me, getting involved and doing volunteering really made an impact. Just spending more time on campus, getting to know professors, getting to know other students, going to CTAs and kind of getting into and learning about some of the research that some of the graduate students were doing, like that really, really enriched my experience. And there's always like, going to Panda games. That was really fun and exciting. Being at Carleton on the beautiful campus that it's on and being next to the river. And I think like those 5 years that I spent there were all memorable. But I find the most memorable is probably when I did, different mentorship with the Bounce Back what used to be called Bounce Back, where I mentored first year students, and also the psychology mentor program as well. I think both of those were really exciting for me to be a part of. So I think that really made an impact on my years there for sure.
Can you tell us about your co-op experiences and how they might have helped to sort of enhance your experiences as an undergrad?
Yeah, so my co-op experience was great. I'm so glad I had that opportunity because I ended up working on campus, as you know, at Career Services, and I had the chance to really get my feet wet in terms of working one-on-one with people in sort of like a coaching, consulting, mentoring kind of role, and helping, current students and alumni figure out what their career path was going to be. So there was a lot of big decisions, problem solving that came into that. So really practiced some of my counseling skills. And there was also, I had a lot of mentors there as well. So it gave me that real world experience and helped me build my confidence so that when I graduated or when I applied to my graduate program, I felt that much more equipped because I'd actually had that whole year of work experience. And I did so many different things and worked on a lot of different cool projects as part of that team. Everything from like communications, multimedia, graphic design, event planning, organizing different volunteer groups, a lot of leadership, and a lot of practical skills too, working at Careers. So I think that was really transformative. I had some really good coaches there and really fine-tuned some of the skills that I have now. Yeah, it really enriched my Carleton experience and just made it that much more memorable. I met so many more people on campus. I got to know professors. I got to learn more about myself from a professional standpoint. So I think I just felt so much more ready when I actually was entering the field. I didn't feel like I had this weird transition period between student and professional. I feel like I'd already kind of found that balance before graduating. So I think that was really beneficial to me.
Yeah, I know we got to know each other a little bit because of that, because you were helping run we have a mentorship program for undeclared students when they come in. And that was something that you were able to help out with as part of your placement, I think, as well there. So can you talk a little bit more about other things from your 5 years at Carleton in the psych program that helped prepare you for kind of what you're doing now?
Oh yeah. So I feel like I'm one of the lucky ones in the sense that what I studied in undergrad is directly related to what I'm doing now in pretty much every way. So I almost wish I would have hung on to my Psych 1001 textbook because everything about child development, I mean, like I mentioned to you before, the primary population I work with is kids. So learning about the developmental stages, and you taught a course on adolescence and emerging adulthood. So working with youth, like all of that was really, really helpful. Just the theory behind it, and just understanding the brain and its functions on personality, behavior, everything. So, and even, some of the courses I took in addition to psych. So my psychology courses were fantastic. Like all of the forensic psych, health psych, all those courses were great. And also I took a little bit of neuroscience as well. So that definitely prepared me for what I'm doing now, just learning, about brain anatomy and physiology and things like that, and how, different medications impact the brain. Just learning all about human behavior in general. I think it's helpful for anyone to know, but especially me working one-on-one with people every day. And I think just like not even just the concepts themselves, like just one that comes to mind is like social learning theory. I can't tell you how many times I use that when I'm working with kids or when I'm working with parents and clients and things like that, I always bring these concepts into my work. But also the practical skills, like the critical thinking, the writing. Right now I do psychoeducational assessments to assess individuals for different learning disorders and different, attentional deficits and things like that. So having that research background and being able to write these clinical reports and do kind of investigative work into the client's background and psychological history, educational history, all of the stuff, all of the skills, like the academic skills, were really helpful. Even just like studying. We don't even realize when we're studying, we're actually practicing our memory and, being able to synthesize information, large pieces of information into smaller pieces, I guess.
Yeah, no, and I think, it's great to hear that, because I think we don't talk about that enough when students are actually in the program. So it's often not until you're finished and you're looking back that you realize, oh yeah, that let me work on my writing skills or critical thinking skills, that kind of thing. And I worked as a psychometrist for some time between my master's and PhD, and I can certainly relate to psychoed assessment report writing. Is a real skill, and it's not necessarily everybody's favorite experience, but the more skilled and practiced you are at synthesizing information and even just forcing yourself to sit down and write it, the better off you're going to be, for sure, kind of thing.
Yeah. And even those statistics and research methods, and being able to pick out, valid assessments, and what's the difference between reliability and validity, and what's the sample size and everything. Even the neurofeedback we do is all based on statistical norms. So having that foundation was really fundamental, I think, for me.
I just want to follow up a little bit. Not that we're really interested in Carleton grads and what you're doing, but there are a lot of psychology students who want to be therapists. Mm-hmm. So can you talk a little bit about what the MEd and counseling was like at Ottawa U, just in terms of maybe just some of the parts that you learn or how it's set up? Because I think there's a lot of fourth year graduating students at the moment who are like, well, I want to apply there, but I have no idea what it's all about. So can you tell us a little bit about that?
Sure, I'm happy to. So the Counselling Psych program at Ottawa U is a 2-year program. You can do the MA, which is a research base where you do a thesis under supervision of one of the professors there, or you do the MEd, which is the one I did. So they look very, very similar. They're both under the Faculty of Education. So there is some sort of, there is an educational component where you learn a little bit about curriculum design, just research and education in general. There's some fundamental courses that you have to take. But some of the core courses include, you learn a lot about counseling theories and modalities. So different therapeutic approaches, everything from like CBT to narrative therapy to psychodynamic, like there's a whole range, right? So you learn about like the history and theory, and then you actually get to practice those skills in your second semester. And in a skill development course, you get practice working with your peers in kind of counseling relationships. And so that part was really fun. And then in your second year, you do an internship. So the internship is usually the whole 8 months where you actually have a practicum somewhere. And you're seeing clients, like you see therapists, you are a therapist and you see clients and have your full caseload and everything like that. I'm trying to think of some of the other courses. We did a psychopathology and assessment course. We did tests and measurements, which is essentially different tools and measures to assess clients' functioning. We did a career theories class, developmental, like sort of a career developmental course. You get some electives too. So I was actually able to take a course in couples counseling as well. There's also like multicultural counseling, group counseling. So it's kind of a mixture of like the theory and the practical.
Right.
Yeah.
Yeah, no, it's neat. I think it's important to hear about. It's kind of like co-op, but at the graduate level, right? In terms of you have those practical experiences, and that's going to put you in a pretty good position then when you're looking for jobs, kind of thing, in terms of the different possibilities once you're finished. Now, I think you've talked some about this, why choose Carleton? We're all wonderful people. But what else? So it sounds like you had some really positive experiences with classmates, with faculty. That's really good to hear. What other things might you talk about to sort of, identify why Carleton might be a good place to do your undergrad in psych?
Okay. Well, I can't say enough good things about the psych program at Carleton, which I didn't really know what to expect. So the fact that it was so positive came as a surprise to me, but I know a lot of other students feel the same way. I would say choose Carleton because the psychology program has so much to offer. There's so many specializations you can take. You can add minors. It's very flexible. You can kind of figure out, or once you figure out what area you're interested in, you can really branch into that. And also the campus is just beautiful. I've said this before, but it really is unique in the sense that it's its own like little, almost like a city or a town that just is, everyone is so friendly. The student support services, I might be biased because I did work for a few of them, but as a student myself, that's one thing I noticed with Carleton is that the support is fantastic. I've seen it firsthand that the staff and professors at Carleton will bend over backwards for students all the time, and do their best to make their experience great and do what they can. So I think that really makes Carleton stand out in terms of like, just, I don't know, just having a really good energy about it. I don't really know how else to describe it. Just Carleton just feels like home.